Borderline personality disorder, BPD, in children and adolescents, recognizing early signs of BPD. Borderline personality disorder, BPD, is often diagnosed in adults, but the early signs of the disorder can appear in children and adolescents. Recognizing these signs early can help provide the necessary intervention and support to manage the disorder before it leads to more severe emotional difficulties and relational problems. However, diagnosing BPD in young people is challenging because many of the behaviors associated with BPD, such as mood swings, impulsivity, and relationship struggles, are common during adolescence. It's important to differentiate between the normal developmental changes of adolescence and the early indications of a mental health disorder like BPD. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the early signs of BPD in children and adolescents and how early intervention and treatment can make a significant difference in helping young people manage their emotional difficulties. 1. What is BPD and why recognizing early signs matters? Borderline personality disorder is characterized by a pattern of emotional instability, impulsive behaviors, fear of abandonment, and difficulty with relationships. It's considered a chronic disorder that affects an individual's ability to regulate emotions and establish healthy, stable relationships. Although it is typically diagnosed in adulthood, the early symptoms of BPD often emerge during adolescence or even childhood. Recognizing these early signs is critical because BPD is often misdiagnosed as other conditions, such as anxiety or depression, which may not address the underlying emotional dysregulation that often defines the disorder. Early diagnosis and treatment, such as dialectical behavior therapy, DBT, can help prevent the escalation of symptoms and emotional difficulties as the child or adolescent matures. Key fact: early recognition and intervention can dramatically improve the prognosis for children and adolescents with BPD, helping them learn to manage their emotions, relationships, and impulses in a healthy way. 2. Early signs of BPD in children and adolescents. While every individual with BPD experiences the disorder differently, there are certain early warning signs that may suggest the presence of BPD in children or adolescents. Recognizing these behaviors early on can lead to a more accurate diagnosis and timely intervention. 2.1 Intense emotional reactions and mood swings. One of the hallmark signs of BPD is emotional dysregulation, which refers to an inability to control or manage intense emotional reactions. In children and adolescents, this might manifest as frequent mood swings, irritability, and excessive reactions to small or everyday events. The emotional intensity may seem disproportionate to the situation and can be confusing for both the child and those around them. Example: a child with BPD may have an extreme emotional outburst over something minor, like not getting their way, and the reaction may seem excessive compared to what happened. Similarly, their emotions may switch suddenly from euphoria to anger or sadness. 2.2 Fear of abandonment and intense attachment issues. Children and adolescents with BPD often exhibit a fear of abandonment or rejection, which can be seen in their relationships with family members, friends, and romantic partners. This intense fear can lead to clinginess, separation anxiety, or dramatic reactions when they feel left out or rejected. They may fear being alone or unwanted, leading them to engage in behaviors to prevent these situations, such as manipulative behaviors or extreme efforts to avoid rejection. Example: an adolescent might exhibit extreme jealousy or possessiveness in friendships or relationships, fearing that they will be abandoned or that the relationship will end. This can lead to behavior like checking in on friends or partners excessively or even lashing out if they feel neglected. 2.3 Impulsive and risky behavior. Impulsivity is another common sign of BPD, and it often appears in adolescents. This can manifest as reckless behavior such as substance use, unsafe sexual behavior, dangerous driving, or binge eating. Adolescents with BPD may struggle to consider the long-term consequences of their actions and may act out in ways that are risky or harmful. Example: a teenager with BPD might impulsively skip school, engage in risky sexual behavior, or spend large amounts of money without thinking about the consequences. Their actions are often driven by emotional distress or a desire to feel in control when they are experiencing intense emotions. 2.4 Difficulty with relationships and idealization/devaluation. Adolescents with BPD may have unstable relationships, swinging between idealization and evaluation of others. They might see people as either all good or all bad, without the ability to see the complexities of individuals. They may have trouble maintaining stable friendships or romantic relationships due to their emotional intensity, impulsivity, and frequent shifts in how they view others. Example, a teenager with BPD may initially idolize a new friend, seeing them as perfect, but then quickly turn on them and accuse them of betrayal when a minor issue arises. Their friendships can be marked by extreme closeness followed by sudden distance or conflict. 2.5 Chronic feelings of emptiness and identity confusion. Adolescents with BPD may often express feelings of emptiness or lack of identity, struggling to understand who they are or what they want. These feelings of emptiness can be overwhelming and contribute to emotional distress. Adolescents may also experience frequent changes in their goals, values, or interests, which can further reflect their identity disturbances. Example, a teenager may go through phases of adopting new personas, changing their style, group of friends, or career aspirations frequently, reflecting an unstable or unclear sense of self. 2.6 Self-harm or suicidal thoughts. Self-harm, such as cutting or burning, can be a coping mechanism for emotional pain in adolescents with BPD. Adolescents with BPD may engage in self-destructive behavior to feel a sense of control over their emotional turmoil or to temporarily relieve emotional distress. Suicidal ideation is also a serious concern for individuals with BPD. Example, a teenager may harm themselves when feeling overwhelmed by intense emotions or after a relationship conflict. They might also express feelings of worthlessness or talk about suicide or death during emotionally charged moments. 3. Challenges in diagnosing BPD in adolescence. Diagnosing BPD in children and adolescents can be difficult because many of the symptoms overlap with typical adolescent development. It is common for teens to experience mood swings, identity confusion, and relationship struggles, which can make it hard to distinguish between normal developmental processes and the early signs of BPD. Additionally, because BPD is typically diagnosed in adults, clinicians may be hesitant to diagnose it in teenagers. 3.1 The importance of early diagnosis. While diagnosing BPD in adolescents may be more challenging, early intervention is crucial. Adolescence is a period of emotional development and identity formation, which means that early treatment can significantly improve an adolescent's ability to regulate emotions, form stable relationships, and build a healthy sense of self. Therapy, such as dialectical behavior therapy, DBT, can be particularly effective in addressing the emotional and interpersonal challenges faced by adolescents with BPD. Key fact: early intervention with therapy and support can prevent the progression of BPD symptoms into adulthood and can provide adolescents with the tools they need to manage emotions, develop self-compassion, and build healthy relationships. 4. Treatment approaches for BPD in adolescents. 4.1 Dialectical behavior therapy. DBT is an evidence-based treatment that is particularly effective for adolescents with BPD. It focuses on emotion regulation, distress tolerance, mindfulness, and interpersonal effectiveness. DBT helps adolescents learn how to manage intense emotions, develop coping strategies, and improve relationships with others. 4.2 Family therapy. Family therapy can be an important component of treatment for adolescents with BPD. This approach involves working with both the adolescent and their family members to improve communication, understanding, and support. Family therapy can help family members understand BPD, reduce conflict, and provide a supportive environment for the adolescent. 4.3 Individual therapy and support groups. Adolescents with BPD benefit from individual therapy that helps them address identity confusion, emotional dysregulation, and relationship struggles. Support groups for adolescents with BPD can also provide a safe space to connect with others who understand their struggles and provide mutual support. 5. Conclusion. Recognizing the early signs of borderline personality disorder, BPD, in children and adolescents is crucial for providing early intervention and support. Symptoms like emotional instability, impulsivity, fear of abandonment, and relationship difficulties are all indicators that should be taken seriously. By understanding the challenges faced by adolescents with BPD and providing appropriate therapy and support, we can help them manage their emotions, build healthier relationships, and avoid more severe emotional difficulties as they grow older. In future episodes, we will continue to explore treatment options, the role of family support, and how to help young people with BPD navigate the complexities of their emotions and relationships. Stay tuned for more insights into borderline personality disorder and how to provide support and understanding to adolescents.